Good day to everyone. Today we are going to introduce orthopedics and orthopedics in nursing. Therefore, we'll introduce some terminologies and also look at another component that is involved in orthopedics and orthopedic nursing. So as you can see with me, there is a slide that you'll be able to follow as we'll be discussing this topic. So we'll start by looking at some objectives, of which we have the general objective, which states that at the end of the lesson, students should be able to acquire knowledge on the principles and terminologies used in orthopedics and orthopedic nursing. Then we have some specific objectives, which states that at the end of the lesson, students should be able to state the principles used in orthopedic and orthopedic nursing. Another objective states that you should be able to define terminologies used in orthopedics and orthopedic nursing. So there we go. So orthopedics is a science which is specialized in the branch of surgery that involves the study and the treatment of diseases of the bones. It encompasses a number of conditions affecting the musculoskeletal system. As you're aware, the musculoskeletal system has the skeletal system itself and the system that has muscles. Now, when you combine the two, you have the musculoskeletal system. So some conditions that affect this musculoskeletal system are the fractures, amputation, rheumatoid arthritis, septic arthritis, osteomyelitis, dislocations, sprains, etc. and etc. So now, the word ortho or the prefix ortho means to straighten. And then ped means child, which is Latin. So meaning that when you talk about orthopedics, we're literally talking about straightening a child. In simpler terms, they coined this term. They used to look at most children with bones that are not in that order, the way they're supposed to be. So they thought of putting those bones in order, because mostly in old days it was done in children. For example, let's say some child is born with maybe rickets, then they want to put them in the way they're supposed to be, the bones, meaning they have to straighten the bones. So because they used to straighten the bones in children, they ended up calling that branch of surgery as orthopedics. So let's first look at the principles that are involved in orthopedic nursing and the treatment. So the first priority in the management of fractures is considering the client is airway, his breathing or her breathing, and ensuring blood circulation. Meaning we're simply looking at the ABCs, which we've been doing in other courses like fundamentals, especially under first aid. So this principle is much applicable if you're found on the scene of, for example, an accident before you attend to the client. Remember, there's a triage that you did in public health 1 for those that are doing general nursing. Under the triage, you looked at the most important things you have to look at. You have to ensure the client you're attending to is actually breathing, or the airway is clear, and also there is circulation through the feeling of the pulse. Then hypovolemic shock may be possible after sustenance of the fractures. The shock may result from blood loss and the body fluids as well as from severe pain. Hence, reassess the client's blood, fluid, and pain threshold to prevent or treat shock. What this principle is simply saying is that if you notice any kind of shock, then attend to the shock quickly, because that may actually kill the patient. The other principle states that always apply ice and elevate for 48 hours post-injury. This elevation actually helps to reduce inflammation. So this principle is much applicable when you go to the hospital, taking the client to the hospital or facility, meaning that when you reach there, you elevate the injured part, at least for the minimum of 48 hours post-injury. That will help in the reduction of inflammation. The other principle states that healing occurs over 4 to 10 weeks if properly immobilized. We're referring to the limb that is affected here. If it is properly immobilized, then healing will take place depending with the area damaged or how big the area that is damaged. But at least 4 to 10 weeks, then healing should be able to take place. So always immobilize the joints, proximal, and the distal by plaster printing. So we're still talking about immobilization of the affected limb. Apply a splint to immobilize it. That will help in the healing process. Then circumferential casting is rarely done in the ED for acute fracture involving edema, which may lead to compartment syndrome. You actually understand that compartment syndrome is one of the complications that happens in fractures, especially if someone has got edema on the affected limb, then don't do circumferential casting. Don't apply the cast around the affected limb. Only apply the cast when the edema has subsided. That's why mostly if someone has a fracture, they need to apply the cast. They first ensure that the edema has subsided by either application of ice, elevation of the limb, like what happens in the health institutions. The other principle states that reassess the patient's neurovascular status after immobilization or manipulation. This ensures that you don't block the blood supply to the part distal to an area where you have applied the cast. So after you apply the cast or the splint, ensure that blood is reaching the distal part from the point of application, because this might actually lead to ischemia if you don't observe that, and it will eventually lead to one condition called gangrene. The other principle states that always consider analgesia or a sedative prior to attempting reduction. When you talk about reduction, we're referring to the alignment of the affected limbs, especially in the case of a fracture. When you align the distal and the proximal limb, we're referring to it as a reduction. It means you have actually reduced that part. So now, before you do that, because of the pain that is present as you try to work on that, you have to consider giving analgesics to the client or a sedative, so that as you manipulate the affected limb, they don't feel much pain. The other principle states that for joint injuries, immobilize the affected part or joint only. Immobilization helps further soft tissue injury and the continued pain. So when you are about to attend to this client or these affected limbs, immobilize them. That will help reduce the pain. Because if you don't do that, those bone fragments where it's broken, they will end up or they will continue tearing the tissue on the affected part, and that will cause intense pain. So those were some of the principles that are used in orthopedics and orthopedics nursing. Now let's look at the commonest or the common terminologies used in orthopedics. So we have what we call a cast. What is a cast? This is simply a protective shell of plaster and bandage molded to protect on a broken or a fractured limb as it heals. An example of a cast is when you apply that which you commonly call the POP or the plaster of Paris. After you've applied that plaster of Paris, we are going to refer to it as a cast. The other terminology we have is arthroplast. Arthroplast means reconstructive surgery of a joint or joints to restore motion because of ankylosis or trauma, or to prevent excessive motion. So here we're simply referring to the reconstructive surgery of a joint. That is arthroplast. In simpler terms, we're simply talking about reconstructive surgery of a joint. That would be arthroplast. Of course, we know one of the reasons is to ensure that we restore motion. Someone is able to make movements the way they used to before the same injury in surgery. How about arthrogram? This is simply an X-ray to view the bone structures following an injection of a contrast fluid into a joint area. So when the fluid leaks into an area that it does not belong, disease or injury may be considered, as a leak would provide evidence of it here. So we are simply referring to the contrast that is injected. As it is flowing, where it passes, if there is a leakage somewhere, it will penetrate through that leakage because it's opaque to the X-ray. You'll be able to see wherever it passes that here is not the normal passage, meaning there's an injury here. The other terminology to look at is a cartilage. This is simply a firm rubbery tissue that cushions bones at joints. If you remember, if you go through your anatomy of the bones, there is somewhere you discussed almost the three types of cartilages, where you looked at the hyaline cartilage and the fibrocartilage and the other cartilage that you looked at. So now we are defining what a cartilage is. The other terminology to look at is dislocation. What is this? It is a complete displacement of one or more bones at a joint. The term here to pay attention to is, or the word to pay attention to is complete. What if the displacement is not complete? What is the rightful terminology for that? We'll meet it somewhere as we go down. But here, get it clear that displacement is a complete, dislocation is a complete displacement of one or more bones at a joint. The other terminology here to understand is active motion. What is this? This is simply joint motion carried out by the patient. The other terminology is ankylosing spondylitis. What is this? It's a type of arthritis that causes chronic inflammation of the spine and the sacroiliac joint. I hope you still remember the sacroiliac joint. Okay, so chronic inflammation in these areas causes pain and stiffness in and around the spine. Over time, chronic spinal inflammation. Of course, spine inflammation, we refer to it as spondylitis. This can lead to complete cementing or fusion of the vertebrae, which is a process known as ankylosing or ankylosis. In simpler terms, you understand or still recall from your anatomy that we have the spine that comprises of the cervical region, which has 7 vertebrae. Also, we have the thoracic region in the spine, which has 12 vertebrae. We also have the lumbar spine, which has 5, and so on and so on. So we're simply saying the inflammation of the spine is known as spondylitis. Now, when you have 2 or more vertebrae fusing, we call that as ankylosis. So ankylosis causes total loss of mobility for the spine because you end up having some vertebrae fused together, and that limits the number of movements one can actually make. The other term to look at is arthritis. This is simply a condition where there is inflammation of the joint. When joints are inflamed, they can develop stiffness, meaning that someone fails to move that joint freely and nicely. There can be some warmth as a result of the inflammation that takes place around that joint. There can be swelling as a result of inflammation. There can be redness as a result of inflammation. There can be pain as a result of inflammation that takes place around that part. So there are simply over 100 types of arthritis, which you'll discuss at some point when you look at specifically the topic known as arthritis. The other terminology to look at is atrophy. The term atrophy simply means wasting away or diminishing. It could be a muscle here wasting or decreasing in muscle mass. So that is atrophy. The other terminology to look at is avulsion. I know you must have come across this term avulsion in head injury somewhere else, but here when you look at avulsion under orthopedics, we're referring to the tearing away or the separation of certain layers. That would be avulsion. So a nerve can be avulsed, meaning it can be separated by an injury, as can be part of a bone. So meaning that a bone can also be avulsed by maybe some amount of force or trauma. The other terminology to look at is the CT scan, or also known as the computed tomograph scan. These are simply pictures of structures within the body created by a computer that takes the data from multiple X-ray images and turns them into pictures on a screen. The CT scan can review some soft tissue injury and other structures, just like the magnetic resonance imaging. And remember that the conventional X-ray cannot indicate any injury to the soft tissues compared to the MRI and the CT scan. The other terminology to look at is chondromalacia. This is simply an abnormal softening or degeneration of the cartilage. The other terminology to look at is comminuted fractures. This is a type of a fracture in which bone is broken, splintered, or crushed into a number of pieces. So a comminuted fracture, in short, will have some 2 or more bone fragments on the point of fracture. That is a comminuted fracture. The other terminology to look at is compound fracture. This is a fracture in which the bone is sticking through the skin, also known as open fracture. You'd actually recall that there are about 6 classifications of fractures, and one of them is actually open fracture as a classification. This is a fracture where there is a communication with the external environment and the fractured bone. But if in some instance you find that there is no communication between the external environment and the bone itself, or the fractured bone, that would be known as a closed fracture. The other terminology to look at is contusion. This is some kind of bruise, or bruise contusion is caused when blood vessels are damaged or broken as a result of a blow to the skin, be it bumping against something or hitting yourself with a hammer. That can lead to a contusion. The raised area of a bump or bruise results from blood leaking from these injured blood vessels into the tissues, as well as from the body's response to injury. The other terminology to look at is crepitation. This is a grating or a crackling sound or sensation as that produced by the fractured ends of a bone moving against each other. You remember that some fractures, you find that when someone has a complete fracture, then the bones will start gliding against each other, and then that will bring about crepitation. The other terminology to understand is internal fixation. This is simply a surgical procedure that stabilizes and joins the ends of fractured or broken bones by mechanical devices such as metal plates, pins, or rods, and wires or screws. Mostly, internal fixation is done in line or in a combination with open reduction. If close reduction and the application of a cast cannot be done, then a surgical team will think about performing open reduction that will be followed by internal fixation. The other terminology to look at is kyphosis. Kyphosis is simply outward curvature of the spine, causing a humped back. It's also known as Dowager's hump or hunchback by other folks or authors. The other terminology here to look at is ligament. What is a ligament? This is simply a tough band of connective tissue that connects the bones and it keeps joints stable. One person would ask you what's the difference between a ligament and a tendon. The only difference is a tendon connects the bone to the muscle, like the way you have the calcaneus tendon connecting some muscles of the calf to one of the tarsal bones in the foot. Whilst the ligament connects bone to another bone, but they are both connective tissues. The other terminology to look at is malunion. This is simply the state of healing of a bone in which bone unites, but in an abnormal position or an abnormal alignment. The other terminology we look at is non-union. This is state of healing of a bone in which there is no healing at all. In short, the bone fragments have failed to heal. Okay? The other terminology to look at is orthopedic surgeon. Who is this orthopedic surgeon? Also known as an orthopedist. This is a physician who diagnoses, treats, manages, and rehabilitates or provides prevention protocols for patients who suffer from injury or disease in any form, in any of the components of musculoskeletal system. What is orthopedic surgery or orthopedics? This is a medical specialty devoted to the diagnosis, treatment, rehabilitation, and prevention of injuries and diseases of the body's musculoskeletal system. What are orthotics? An orthotic is simply a support, brace, or splint used to support or align or prevent or correct the function of movable parts of the bone. The other terminology to look at is osteoporosis. This is thinning of the bones with reduction in the bone mass due to depletion of calcium and the bone protein. You'd recall from your anatomy that calcium is a good element to help us strengthen the bone, which is one of the nutrients, the elements that we actually get from foods like milk. So when the amount of calcium is actually depleting from the bone tends to be weak. And this leads to the condition we are calling osteoporosis. The other terminology to look at is synovectomy. This is simply the surgical removal of the synovial membrane. You actually recall from amongst the joints that you discussed in fundamentals in anatomy, you discussed the types of joints. And one of the joints you discussed there was a synovial joint, which is actually surrounded by the synovial membrane. Now, when you surgically remove the synovial membrane, that is known as synovectomy. The other terminology to look at is synovium. This is simply the lining of the joint. The other terminology to look at is arthrodesis. This is the surgical fusion of a joint. I hope you are able to get a difference between arthrodesis and arthroplasty. Please get the difference there. Let's look at traction. This is the use of systems of weights and pulleys to gradually change the position of a bone. It may be used in cases of bone injury or congenital defects to prevent scar tissue from building up, in ways to limit movements or to prevent contractures in disorders such as cerebral palsy or arthritis. I'm sure you've gone through the hospital, especially the surgical ward, where you found some clients having some pulleys or some weight applied to the lower limbs. That is actually traction. It is meant to help align the fractured limbs, and you understand the functions of traction at some point when we discuss the orthotics that are used in orthopedic nursing. The other terminology to look at is bursitis. This is simply the inflammation of the bursar, which results from repeated or excessive trauma or friction, even gouty or infection. The other terminology to look at is phantom limb sensation. This is when a patient feels like the amputated limb is still there. This occurs in about 90% of the amputees. The client who has undergone amputation is known as an amputee, whereas the surgeon who was conducting the amputation is known as, you can guess the answer for me because you've done this. So some clients, when they undergo amputation, even after amputation, they still feel that that limb is still there. That feeling or convincing feeling that the limb is still there within the client who has undergone amputation is what we refer to as phantom limb sensation. The other terminology to look at is osteosarcoma. As you understand, osteo comes from bone tissue. Sarcoma is to do with the cancer. So we're saying this is simply a primary bone tumor that is extremely aggressive and rapidly metastases to distant sites. Remember, there are two classifications of bone tumors. A bone tumor can be primary, meaning that it originates from the bone tissue itself, or it may be secondary bone tumor, meaning that it originated from the soft tissues around that bone, then it only spread to the actual bone. That becomes secondary bone tumor. The other terminology to look at is chordoma. This is a rare type of cancerous tumor that can occur anywhere along the spine, from the base of the skull to the tailbone, which is the coccyx. So if this tumor affects any part of the spine, it will be a chordoma. Now let's look at this terminology, subluxation, which is almost having the same meaning with a dislocation. I know most of the medical people, as they diagnose their patients, sometimes they must have diagnosed a subluxation to be a dislocation or vice versa. So subluxation, this is a partial or incomplete displacement of the joint surface. Remember, at some point we talked about complete displacement of the joint surface. Now we're talking about incomplete displacement of the joint surface. Please get that difference as well. So finally, I have definitely and deliberately repeated the terminology dislocation for you to get the clear difference. So dislocation is the complete displacement or separation of the articular surfaces of the joint. Please get a difference between dislocation and the subluxation. Thank you so much for listening. This was a tutorial on the introduction of orthopedics and orthopedic nursing. If you have any questions, you refer to my YouTube channel, search for my name's Francis Muche Managasali on YouTube, and you meet some more of tutorials of this nature. Thank you so much for listening. I hope we'll still meet again, or we'll still discuss. If we don't meet on forums like this one, then you might find some of my tutorials on YouTube. Thank you so much and have a good day.